Okay, being streamed.
Okay, we're good.
We're good.
Mhm.
Okay, welcome everybody to the May 2026 meeting of the Health and Human Services and Education and Unhoused and Shelter Committee. Um, we actually had two speakers scheduled for tonight, but just so you know, we will be hearing from Primary Care for All Americans another time. They had an unexpected emergency, which so they're not going to be able to speak tonight. Um, but we are fortunate to have Belice Sanchez from the New York City Department of Health here, who is going to give us a presentation about the new Family Home Visits Initiative. And Belice, thank you for making it tonight. We appreciate it.
Thank you for inviting me. Um, so just go right ahead,
Just go right ahead. Do you need
um,
sharing privileges or anything? Do you have a
please.
PowerPoint?
Yes,
Okay,
I do.
Okay.
okay,
She's able to. She's a co-host right now.
okay. All right.
Okay.
Thank you for setting that up already, Raphael.
Okay. Okay. I'm used to Teams. So the Zoom throws me off
Oh,
sometimes.
oh, that's interesting. I don't know. Teams is quirky to me. I don't know.
Okay, great. So
Okay.
let me just, sorry, I have to use two devices, unfortunately.
Okay, that's all right.
Um, okay, perfect.
Okay.
Look at that.
Looks
Beautiful.
good on our end.
Yes.
Thank you. So thank you so much for allowing me the space today to share the new Family Home Visits Initiative. As it was stated previously, I'm with the New York City Department of Health.
Elise, can I
Um,
interrupt you? Is it new families or new initiative?
it's the new Family Home Visits Initiative.
It's a new
Yes.
initiative, not just for new families.
Well, it's new families. I'll go into more details and
I'll wait. I'll be
yeah,
patient. Thank
yeah.
you.
So just a quick agenda. So I will go into what is the new Family Home Visits Initiative, what is the coordinated intake and referral system, the home visiting programs that are available through the CINR system, and then questions. So the new Family Home Visits Initiative. So it is a mayor initiative that supports the citywide health equity goal by identifying maternal health needs during pregnancy or soon after childbirth, preparing families for their delivery and a new baby, and connecting families to needed services. And our mission is to reduce maternal and child health inequities in communities most impacted by the COVID-19 pandemic. So what is our coordinated intake and referral system? So it is a multifaceted HIPAA compliant web-based tool that we use, and it is built within the Unitas platform. Um, and navigators utilize the CINR system to screen eligible pregnant and parenting families and refer them to home visiting programs and community services according to what their needs may be at that moment. And the CINR system provides a fast and efficient way for NYC healthcare and social service providers to manage, track, and share family referrals with partners within their care network. And then the CINR system is funded and operated by the New York City Department of Health um, as part of the new Family Home Visits Initiative, which means that providers who see that there is a system that they would like to use and they would like to go into a partnership with us, they do not have to pay anything in order to be able to use the CINR system and make referrals. So how does the CINR system work? So the Family Connection Network which is within the new Family Home Visits Initiative. So it's we are a group within the new Family Home Visits Initiative. And we are a team of trained public health professionals who use the CINR system to screen and refer families by phone. Um, the Family Connection Network navigators assess each referred family for a variety of vital home visiting programs, all of which provide services and referrals to pregnant and parenting families. An intake call can take 3 to 5 minutes. I do call families, and I have been on the phone for upwards of 30 minutes, depending on the family's, language needs. Sometimes moms just want to chat because, it is that critical time, like 2 to 3 weeks postpartum, and they're going through a lot of things. So it all depends on the family's needs at that moment. And then at the end of the call, families are referred to a home visiting program and or resources in their community. And these resources are shared with the families via text, email, or mail. So when we call the families, the navigators, and we screen them, the screening questions consist of pre-screening and prenatal, like when did they start their prenatal care? How many weeks were they? Are they already receiving any home visiting services? Postpartum questions, housing stability, like are you in a shelter? Are you homeless? Do you have a stable home? Benefits eligibility. Are they already receiving Medicaid, SNAP, WIC? Food security, some families aren't unable to receive SNAP. But have you been worried about having food in the last 30 days or 60 days? Exposure to violence, and we require the client's consent, which is built into the system. So these are the home visiting programs that are available through the CINR system. Our target demographic are pregnant and parenting families with children between the ages of from birth to 4 years old or 48 months. And this includes foster parents and parents who adopt children. All services are provided regardless of the family's socioeconomic status, race, ethnicity, gender, or immigration status. We do not ask those questions, which is critical in today's atmosphere, I think you can say, with everything that's going on in today's world. It's important for them to know that they are safe and we are a safe place that they can call for help. So programs include the NYC Nurse Family Partnership, which provides no-cost nurse home visits to low-income pregnant families. And it is available to anyone in New York City across the 5 boroughs, regardless of like what their zip code is, regardless of their income. And it is currently who is currently pregnant and is eligible for Medicaid. So they don't necessarily have to be on Medicaid, but be income eligible for Medicaid or WIC. So personal services include personal nurse visits beginning during pregnancy until the child is 2 years old, maternal and child health education, connection to health and social services, mental health care, and personal goal setting. We also refer families to the citywide doula initiative, which provides doula support before, during, and after childbirth to pregnant people and their families who are income eligible to Medicaid and live in a tree zip code, a shelter, or a foster home, or are younger than the age of 20. Services include the doula support, 3 prenatal visits, labor and birth attendance, 4 postpartum visits, and connection to additional support like breastfeeding counselors, mental health professionals as needed. We also refer to Healthy Families New York, which provides home-based services to expectant families and new parents, beginning prenatally or shortly after the baby's birth until their child enters school or Head Start. Services include family support specialists, assessment of child development, parenting and child development education, and connection to other community resources that the family may need throughout their participation in the program. And then one of our internal programs, the Newborn Home Visiting Program, which provides post-discharge support to families with a new baby up until the baby. Referrals are made at a maximum of 3 months old. And they provide a multidisciplinary team of nurses, lactation consultants, and they also have social workers on staff. Services include breastfeeding and nutrition support, safe sleep education, child development education, health insurance enrollment, and mental health, physical health, intimate partner violence assessments, and referrals to early intervention and other community resources. And then finally, we have the Power of Two program, which utilizes the evidence-based program attachment and behavioral catch-up, or ABC. They provide support to the primary caregiver. It could be adoptive parent, foster care parent, primary parent, or it could just be it could be a temporary foster care parent who has the child temporarily while the mom or primary parent is going through a process. Services are provided to families who have children between the ages of 3 months to 48 months old, to help the caregiver develop the responsive skills that they will need to help to raise this child, or be with this child on a daily basis. And services include in-home parent coach, ABC program that is completed over 10 weeks, 1 hour per week, and connection to community resources. So how does the CI&R system benefit providers? So it provides a fast and easy way for providers to refer families to home visiting programs. Sometimes I used to work in case management, and I would end up making phone calls and sending emails and not being able to track referrals. So using the CI&R system, providers can actually have access to this information and see, oh, okay, when was this? I referred this family 2 days ago. Were they called? Were they screened? What resources was shared with this family? Were they referred to home visiting programs? Once the referrals is made to the home visiting programs, did the home visiting program call this mom? What's the update? So they're able to access that information. They're able to connect their families to vital home visiting services, including referrals to services and resources that complement the program, and improve their clients' overall health and well-being. And it also eliminates the need for the organization making the referral to determine eligibility. If I'm, like, for example, if I'm a provider and I'm working with a person who is pregnant and they are 5 weeks, and I wouldn't have to go and search to see what programs they're eligible for. I just know that the Family Connection Network, this is their target demographic. So I can just refer them, and they will call and screen and ask all the questions to see what program this family is eligible for. And it also enables partners to access outcomes of referrals and run reports. So however I can, if I refer, let's say 100 families in a year, I can access that data showing me what home visiting programs this family was referred to. And once again, the CI&R system operates at no cost to providers. So the new family home visits program materials are available for order online for free. So if you visit nyc.gov/health and search for breastfeeding, all of these pamphlets are available to the public. You can also email your request or call 311 or the 212 New York number. And questions? I will bring myself back up.
I'll answer my own question, which is the new applies to the families, which is
Yes, new families.
Yeah. It's only, I mean, it may be a new initiative, I don't know, but it's
So the initiative was it was an initiative that started right around right before COVID, but because of COVID, it kind of just the priority was COVID and the vaccination and outreach and contact tracing and testing. So it was a little bit chaotic, but we've been working very, very hard to get the initiative back on track. get the information out there that this is out there. These are services that are available to families in New York City.
And Belize, can you stop sharing so that we can see each
Yes.
other a little bit better? Thank you.
Did it stop sharing? Yes.
No, it's still.
Yeah.
Oop, let me see. Stop sharing
Okay.
here. There.
Okay, thank you.
Perfect.
Okay, thank you for that.
Yes.
Okay. And then Andrea, I see you have your hand raised.
Hi, Belize.
Hi, how are you?
Hi, how are you? So I had a quick question. In
Mhm.
terms of the platform, it's Unite Us that you're currently using, correct?
Yes, we're
Is that
currently
what
using
it's-
Unite Us.
Right. Okay. So if an organization is already on the Unite Us platform, would they be able to access the information or be able to make referral through that system to your program? Is my other
They
follow-up
would,
question.
so they would be able to make referrals, but so the referral team is a separate team, and there are certain like requirements when making a referral that need to be met. So a lot of times when organizations that we're not partnered with make referrals, oftentimes those referrals get rejected, unfortunately.
So I'm going to ask one third and last question. In terms of Unite Us, are you working with partners that are working with under the social care network like PHS? Is that a partner?
We are working with PHS.
Okay.
We actually we receive referrals from PHS and we make referrals to PHS because we do have like a direct partnership with these organizations. So we do work together.
Okay. Thank you.
And what does PHS stand for?
Public Health Solutions.
Okay. And then who are your other partners?
Let me just pull up the
Okay.
list.
Thank you.
Of course.
I see we also have a new member who's now joining us in this committee.
Yes, and we're going to introduce him after because yeah. So yeah, we're gonna and
So
thank you. Go ahead.
Yes, I'm sorry. So we are currently in partnership with Lange Community Progress in Rockaways, Brigada de Esperanza, Brookdale Hospital Healthy Families, the Brooklyn Perinatal Network, Chances for Children, Community First Equity, Community Health Center of Richmond and Staten Island, Episcopal Health Services, Flushing Hospital Medical Center, Hope and Healing Family Center, Mama Glow Foundation, Northern Perinatal Partnership, Queens Child Care Network, Rising Ground, Wyckoff Hospital, to name a few.
Okay. Thank you for that. And
Of course.
Amparo?
Thank you so much. Belize, I had a couple of questions. The first was, what does TRIE stand for? TRIE? The zip codes?
My
It wasn't
apologies.
written out,
Yes.
the acronym.
Yes, because I didn't know how much time I would have, so I kind of left
Gotcha.
some slides out. But I can absolutely answer that for you. So that is the Task Force on Racial Inclusion and Equity in Neighborhoods. So these are zip codes that were identified during the a little bit before the COVID pandemic, but then it kind of like reinforced the need in these areas during COVID. And it includes zip codes. Let me just pull it up on my end. So just want to make one thing clear. So the TRIE zip codes only apply to the newborn home visiting program because the Nurse Family Partnership is citywide. Healthy Families New York, they have their own zip codes that they have identified. Power of Two also, and the Citywide Doula Initiative also has their own zip codes. So the TRIE zip codes only apply to the newborn home visiting program. I will actually share. Let me see if I can share a programs and resources flyer that we have available in the chat.
That
Okay,
would
yes,
be
I
really
can share.
helpful. Because I'm just thinking specifically about our community board and the folks that might be eligible. for this. So I'm wondering if any of our zip codes would be a target.
I don't really know how to attach in the chat.
Seems that 11101 is in.
There's a file button in the chat, and you can upload a file that way.
It says type or paste a link.
Okay.
Is it okay if I send it to you, Lauren?
Yes, yes, you can
Yes, I
send
think
it. And
it'll
then
be
and
best.
as well as a
And then-
copy of your PowerPoint if you haven't
Yes,
already.
of course.
Okay.
And then I was
Mhm.
wondering another question, could families like self-refer? Is that
Yes,
something?
they can.
And how would
They-
someone do this?
So on our pamphlets, there's a QR code that is available to them. There's also a phone number that they can call. I do have pamphlets, not with me right now, but they can self-refer within the pamphlets. There is a phone number and a QR code where they can reach out and refer themselves.
Follow-up question. What
Yes.
languages? I remember you were saying you had a family, that, these intake conversations
Mhm.
could last up to 30 minutes depending on language. What
Mhm.
languages are potentially served?
By the Family Connection Network,
Yeah.
we use the language line, so we are able to connect with all families regardless of their language.
Thank you.
You're welcome.
Okay. Did anybody have any other questions? Braz, I'm expecting a question from you. Your signature question at the very least. You're muted, Raz, Dr. Raz.
Yeah, well, I have my basic question is how can we help? And before I let you answer that, I do have one suggestion. We do have a newsletter, and I know that our Raphael is a past master at generating a very brief summary, which would lead people and link people to this presentation. And I might suggest that bare minimum, we start doing that with our meetings. More homework for you, Raphael. Sorry. He just revealed this
No worries, you're
talent
good.
last week, and it might
Well-
turn out to be very useful. Go ahead.
Well, the how can we help? I think I'm limited in how I can answer that question, because I feel like that's a communications team question. But as a provider liaison, I think sharing our pamphlets would be amazing, just because it allows for our resources and the information on the initiatives to just get out there and be in the community. We've been working really well. I can only speak for myself and Kayla Star Asia. We've been working very hard, specifically in Queens, because that's the zip code that she and I focus on. To just get out there and make sure that the community knows that these programs are out there. I spending so much time in Queens. There are parts in Queens where people just feel forgotten. Like there's nothing out here, and there's nothing, like they don't care about us. Because sometimes I go and I stop people randomly, and I'm like, hey, like where do you go for, like, if you need to do your health insurance, or where? And they're like, oh no, there's nowhere here. When I look, there's nothing in their area for like a 20-minute walk. So just sharing our pamphlets, I would say from my level.
So maybe the links to those pamphlets, because I don't
Yes.
think we're going to literally pass out pamphlets.
No. Yes. I'll make sure to send that to Lauren, the pamphlets and
okay.
programs and resources
Okay.
and the slides.
And then as far as the emails that we've been done, the community board office is also is on those emails as well. So when you just do a reply all, and it'll make sure that Raphael gets it as well. And if you
Great.
wanted to, I appreciate your answer. And if you wanted to like get more, like follow up with the communications team and just let us know if there are other ways, that would be
Mhm.
great too.
Yes, thank you.
You're very welcome. Thank you. Andrea?
Yeah, hi, Belize. Another question came to mind. Are you working with physicians or are you just working with physician group like clinics? How, say for example,
Mhm.
physicians that are caring for OBGYN,
Mhm.
how is that connected? Because
So I can only speak for myself. Like I said, I'm assigned to the borough of Queens. Working with like individual, like private, like per like if I'm a OBGYN or a pediatrician, it can be a little bit difficult because they don't have the support staff. And doing this, going into a formal partnership and having to do an agreement and go through the training requires time that sometimes their staff they don't have. So it can be a little bit challenging when it comes to individual providers. We're seeing that for larger providers like for example, like Kayla Star Asia is working directly with like Tribeca Pediatrics. They have support staff when a parent comes in to see their pediatricians. They identify this family might have needs, and they refer them. They have a referral team that Kayla works with directly. So we find that with like that helps a lot to connect families. But when it comes to like those individual clinics where it's just a primary doctor or OBGYN and like their front desk and a nurse, it can be very challenging.
no, I understand. I get that.
Yeah.
So does that mean that there is a barrier to access of the information based on that? Because I understand the
Mhm.
public hospitals, it's easier to
Yes.
make referral because they're
Mhm.
already connected through the
Yes.
system. But if
Yes.
someone is seeking care outside of that, and
Mhm.
because of limited resource
Yes.
within like a physician group, then this is information that no one really have access to. Got it.
Yes.
Okay.
So
Yep.
our main Kayla Star Asia and I are focusing mainly on just continuously showing up to these individual clinics and just letting know the presence is like just making ourselves present and known and bringing our pamphlets and making sure that they're in the waiting area and just speaking to that person in the front desk, letting them know this is what we have available to your families.
Yeah, I can't figure out how to hit for some reason, the raise hand thing, so I'm doing it in the old-fashioned way.
That's fine. Recognized, Dr. Raz.
But I'm presuming, I don't know if there are any birthing centers that in the city, the way years ago, I actually had a baby at a birthing center. It was beautiful. And but there, I'm sure if you're working with midwives and so on, or nurse midwives.
No, not that I know of at this time. I think there's only one birthing center. I could be wrong. I know there's one in Brooklyn.
Yeah, there are two in Brooklyn. We learned at the
One in
last
Brooklyn and one in
meeting.
Manhattan, right?
Yeah,
Two in
there
That was
Brooklyn.
our last speaker.
Yeah.
there are perinatal. There's like two. There are perinatal organizations, but there's no birthing centers in Queens that I'm aware of. But there are like the doula collectives.
And Belize, there is a campaign to get a birthing center in Queens. So that was last month. That's what we learned last month. Okay.
Okay.
Yeah, and the organization was called Birth by Queens.
Queens.
Definitely connect with
Because
them.
I think there's a lot of barriers for midwives to kind of get birth. I know that there's a lot of like red tape around birthing centers.
Yes.
I I've had two children. The nurses were mad at me because I wanted to do things a certain way. But I personally I see the need for birthing centers. Hospitals can be a lot. That's all I'll say.
Mm-hmm.
Yeah.
Amparo?
Sorry, another follow-up question.
Yeah,
When
yeah.
you were talking about referrals, I know from past experience with home visiting programs, I worked on a program replicating the Family Connects program out of Duke University, and that was universal. So that was no matter socioeconomic status, no matter demographics, like every family was screened. And we found that the most popular referrals were for lactation consultation and for WIC and SNAP. Could you tell me if that aligns with the kinds of referrals that most
Yes.
families are getting here?
Yes. I can only speak for the families I refer because I do so aside from liaison work, I also do navigation work. So I do call moms. A lot of the moms do require WIC, especially the immigrant moms who recently came here. They don't know that they are eligible for WIC. So there's a lot of WIC referrals. Some moms, for example, was it this week? It was last week. There was a mom, she's new and she's pregnant, no prenatal care at all because she's afraid to go to the hospitals and she's afraid. So we get a lot of cases like that where they need those referrals, especially for breastfeeding. I feel like there's so much information, but there's also a lot of misinformation when it comes to breastfeeding. So moms are doing things that can make it more challenging sometimes for them. So breastfeeding is also one of those referrals, especially for newborn home visiting program. They do have IBCLCs on staff, and if needed, they will do a home visit to help the mom one-on-one. So it's right in line with those referrals that we make.
So would you coordinate with like La Leche League or organizations like that support breastfeeding?
So that, as far as with the La Leche League, I am aware of the La Leche League, but we haven't been cleared, I think. I don't think it's ever been brought up to partner with La Leche League. We do, so like I said, the newborn home visiting program has IBCLCs on staff. We do refer to I know it's in Brooklyn, Hope and Healing. They have IBCLCs that we refer moms to. A lot of these organizations, they like NMPP, Ancient Songs, they have breastfeeding support. Public Health Solutions has a breastfeeding warm line. So we do make those referrals. Health Star also.
Thank you.
Any other questions? Okay. Belize, I want to thank you again.
No, thank you so much.
Okay.
Thank you so much for allowing me to be a part of this. Thank you.
Okay, good. Okay. Thank you. You're welcome to stay for the rest of the meeting, but you're also welcome to go if you have to, so that's fine. But we just want to thank you again. Okay. Okay, before we continue, I just want to introduce Rabbi Zev Weinberg, a new committee member. So I don't know if you wanted to tell us a little bit about yourself, but we're glad that you decided to join our committee.
Thank you, Lauren. I appreciate that. It's nice to meet everybody. Not much of an intro. I started and run the Jewish Community Center here in West Queens. We're based in Long Island City. We've been here since 2005. So we really, have a lot of good relationships all across West Queens. And I know very little about the inner workings of how these things work, but and it seems like you guys are very well staffed. I feel a little bit redundant, but I'm sure after some time I might be able to provide some kind of insight or help, and I'm here to help. So
Okay.
I look forward to it. Thanks.
Oh, no, I don't know what you mean by redundant. We don't think you're redundant. I don't know if you meant for this committee or what. No, we welcome you here, and glad you decided to join our committee. So we meet virtually second Monday of the month. And one of the things that we've been trying to do is like as you can see when I asked like Dr. Roz, like what's the her signature question is how can we help? So it's like what we've been doing is we've had speakers come, different issues and everything else. Like a lot of times too, people will reach out to the community board and want to present to on our committee and whatnot. But our thing is like, what do we do with the information? Because we don't just want to be like this repository of information. It's what do we do? What do we do? How can we help? How can we serve and whatnot. I don't know if anybody has anything else they want to add, but we're just glad to have you. Roz, you're muted.
I have a question,
Sure.
and my question is simply, what was it that made you want to join Health and Human Services and et cetera?
Fair question. So I'm not, aware of all of the committees, and I was talking with Ashraf, is that his name? Yeah.
Anatole.
And-
Anatole.
Mm-hmm.
Say it again.
Anatole. You're
Anatole?
pronounced Ashraf is his last name.
His last
Anatole.
name. Okay,
Yeah,
Anatole.
Anatole.
So so he was like, okay, we got to get you on a committee. I'm like, okay, tell me what committees. He says Health and Human. I said, that sounds great. There's nothing more important than health.
Okay.
So sounds
All
good
right.
to me.
Okay. All right. Okay. Are you in land use as well? Because that's where I first saw you. It's like the
No.
land. Okay. No. Okay.
No. I just showed up because I thought that was a community board meeting.
Oh,
So,
okay. Right.
Yeah.
Okay.
It was fun.
Okay.
You're not
Good.
required to go to all the committee meetings.
No. I know that, but they want that when you first join to sort of to get a taste of it to see, right, where you want to land, right? So we're glad you landed here. That's all I'm gonna say.
As am I.
Okay. Before you came, we mentioned that the presentation, the primary care for all Americans, are not going to be able to make it tonight because of an unexpected emergency. So Belis was our only presenter tonight. So now we can move on to, guess it's old business. Any old business? Any new business? Okay.
I guess we're done. I wanted
Go
to
ahead.
thank Raphael for sending the email about the letters. So thank you very much for that. Because we got some stuff done. So I was really glad to support, you know.
For the City View shelter?
Yeah, for the
Okay, so that
shelter.
letter has gone out. Okay, so because it was, I don't know, the March meeting, we had Warren Davis and Tom Matusitz from Blissville Civic Association came and talked about an issue about the conversion of City View shelter from a family shelter to a men's shelter. And then basically the issue really was more about like the lack of transparency and communication about the temporary shelters in Blissville. And so we agreed or voted to write a letter, basically it's a letter of inquiry really, to get information. And so that letter has gone out.
May
Sure.
I?
Mhm.
Yeah. So is most of what is done here, seeing what is out there and seeing how to help, or are there initiatives? Like, are you looking to initiate?
I think most of it has been like more responsive. There are things I guess we could initiate if we were aware of like issues in the community and everything else like that. So I mean, we haven't necessarily done that so much, but it's like there's nothing stopping us from doing that.
Right. I'm just trying to get a taste
Mhm.
for, like if you could share maybe in the last year or two, like what of some of like, your proudest, accomplishments, then that if you could, just do that all the time, that would give me an idea of like what, what the goals are, so to speak. Or is it just to further, the agenda, be the bridge between the providers and the community?
I think I mean, part of it's to be the bridge between the providers and the community. I think it depends on what's happening. Like I feel like as far as like so it's like so I like and then I know there's also some emails that have come lately with people wanting to collaborate with different things. So somebody reached out recently, I think in terms of like wanting like looking for volunteer opportunities. Like I saw that email today about some high school students wanting to have like a get involved with like food distribution. So that's something that we could probably connect. I think for me personally, and other people may have different answers, I think there's two things that sort of stand out for me as like the proudest things was really the connection with Witness to Mass Incarceration. Um, and so Witness to Mass Incarceration is run by Evie Litwack, who's somebody who has lived experience being in of incarceration, who started an organization that basically tries to help people who are returning home and with a focus on entrepreneurship. So she has like she's connected with the Queens Economic Development Corporation, and she has like a program that teaches people how to repair sewing machines and then also like tailoring. And then also some other initiatives that are coming out. And she presented, but it was interesting, sort of like there was like kind of snowball effect with that because I know Dr. Roz, you got connected to her. She got like connected to like Donovan um Richards, and
Richards.
just you want to, I don't know. I just feel like there's just like been a snowball effect with that. So I don't know, Dr.
Yeah,
Roz, if you want to
for
explain.
instance, they're doing, you say tailoring, I mean, fashion design in a
Mm-hmm.
very advanced, well, modern kind of way, I suppose,
Mm-hmm.
with a lot of verve and flair. And they did have a fashion show, and they got the borough president, Donovan Richards, to model, I guess, something that they had done for. And there were two other people. I don't remember who they were, but they were also pretty well known. And all I know is I actually went with Evie out to the fitting with her tailors, with a couple of people. We went to his office, and there was a muslin kind of linen thing, which I guess tailors use to do the sizing. And apparently the joke was that he apparently thought that was the suit. It wasn't. But in any event, it was kind of cool. And I mean, she's really quite a spark plug and is an interesting organization. She then also became an honoree at the Pride Parade in last June. Um, so she, that was one group. And what else have we done? That's I think
Okay.
one thing, yeah.
No, go ahead. Go ahead.
The one thing I would really want you to know about is the whole, we referred to the City View shelter and the whole area of Blissville in our district, which is, if you go down Greenpoint Ave, before you get to Brooklyn, that's Blissville. And it's a very industrial area, but they also have a number of hotels that have become shelters and so on. And the thing to me that always impresses me with Blissville is that where in many places they say these are wonderful things, but not right here. And Blissville wasn't being NIMBY like. It was, but the city hasn't always risen to the occasion. So we like to support them. And one of the, well, Warren Davis has been a Blissville, he's a community board member, and there's a couple, Evelyn Shango, I believe, and maybe Fernanda, he's the other Raphael, right? Yeah.
Perez, yeah.
Yeah, Perez, there we go.
Yeah.
Anyway, are from that area, and there are shelters elsewhere, and we've had a number of presenters with pointing out different aspects.
Yeah.
So I think that's
Yeah.
been very important.
Yeah. And I think the other thing, the second thing that stands out for me is really I like the was Aviation High School. So they had um they were like there was a whole campaign and they were trying to raise money for to get repairs to their what is that? I forgot what the
Like a cell or something, right?
cell,
Yeah, it was
yeah,
like a cell, yeah.
yeah, engine, yeah. And so what we ended up doing too was we ended up actually getting a tour of their high school, but part of it. And then also at the end of that, it was like they were asking us for ideas about like how to get connected to people in terms of getting money raised for this. And so it was just like, but it was impressive. It's like, and I remember Andrea, you saying that the high school is like a gem in this neighborhood because it was amazing when we took that tour. So it's just, yeah. So those are the two things that stand out for me. Amparo.
Yeah, for me, it was supporting the public bathroom bill back last year, and it did pass. So like we wrote a letter to support it. We had a bunch of presentations from another community board member from Manhattan, remember? And she came, I think she was a public member. Anyway,
Yeah.
you know, and we wrote a letter, and yeah, even Mayor Zoran Ramdani, he's like supporting, you know, implementing this by 2035 or something like that, having more public bathrooms. So like that's a huge win because I know myself, like 2 pregnancies trying to find out like which radius I can actually leave my house so that I can find a restroom. Like that was so on top of mind for such a long part of my life. I felt that like everyone should have access. I mean, equal and equitable access to restrooms, right? No matter where they are in this city. So that was for me a huge win from our committee.
Yeah. And it's funny, Amparo, too. You think about the same thing, public bathroom access, the older you get too, but it's also, and every time a store closes, like a department store, you're like, oh, now that's another bathroom that's lost, or now there's, so you have to, plan accordingly. Andrea, I don't know if there's anything that stands out for you. I don't know.
Well, actually, what I was thinking about was, I think it was last year when we were working on a resource. We were looking at creating a resource list for families. And I think for me, I think that that was also impactful because I think that, I think within communities, oftentimes we hear a family not knowing how to access information. And I think that we came up with a very good list in terms of resources that I know that we shared with the community board. So I think Zev, the other thing that I think was also, I mean, I've used this committee to like bringing feedback to my organization, Sunnyside Community Services, in terms of where there may be gaps that we that we can serve in community as well. So I think that it's really an opportunity in terms of social service agency like Sunnyside to really connect with the community and work in a very meaningful way at the committee level, because sometimes at the board, at the board level, it's very, it's huge and there's a lot of interest. I think in the committee, it's a lot more targeted in terms of what we look at.
And then we've also, thank you for that, everybody. And then we've also been able to weigh in on like budget. So when we're talking about capital and expense budget, so we're able to like propose things that are important and that bear on like health and human services, shelters, everything else like that. So, but yeah. I hope
One
that
last
answers your-
question.
Go
Yeah,
ahead.
very, very, very much. You've
Okay.
got it all running now.
Okay.
How long have you guys been on this committee? Oh, you don't have to answer that.
No, I'm trying to. Okay, go ahead. I don't know.
I feel like I've been on here since 2019, right?
Whoa.
Yeah.
2020, something like that.
Yeah, I feel like it's been a while. I've been on the various committees. I don't know. I feel like it's been I don't know, maybe 6, I don't know, 6 years, but because I've been on various committees. And actually it was interesting because there used to be a standalone, at one point there was a standalone education committee. And then the chair of that stepped down, and then the education was like a subcommittee of land use, and then this thing formed. So it's like or this thing became part of health and human services. So it's like I don't know, maybe I don't know. I feel like it's been a while, 6 years maybe.
That's great. That's great.
I've been on, I was appointed to Health and Human Services in the first year I was on. It almost never met, which I thought was frustrating. I think also it's perhaps useful to know a little bit about our backgrounds. I mean, I am a psychologist. I don't do psychotherapy. You needn't worry. I can't read your mind. But I have a very specialized practice. But the point being that that gives me an angle or an interest, but I'm not really if I worked in the in a hospital or institution or had a real active practice, it would be perhaps different. But I'd like to hear more about your organization. I hope we'll have an opportunity, because you must have a lot of really human service that isn't that part of your mission?
Sorry, opening up my son's iPhone is part of my mission. Yeah, no, it definitely is. I mean, Yos, can you turn the volume off? Thank you, sweetie. I mean, yeah, we encounter everything, because our mission is very open-ended with regards to who we serve and what we provide. It's really anybody that shows up in any capacity that's needed. So, when the war started in Ukraine, somehow a lot of Ukrainian refugees landed right here in LIC, and they just walked in, and so we just helped in any way. We collected clothes, we got them jobs. We don't have official programs for all of these things. Part of the reason that I wanted to get on the community board is to really understand how to properly provide support for people, because it's come to the point where I mean, we're very limited. We can't just take everybody, so we have to be able to work a little bit better. But I do go around a lot. I have a lot to do with seniors, because I get I don't know if you're familiar with the organization Chabad, but Chabad is it's an international organization. Each location is independently started and independently run, but we share a common theology. And there's about 5,500 all over the world. And so in the Jewish world, everybody knows that if you need help, you could just call Chabad. So there's a big aging population here in West Queens, and their children don't live here. So whenever somebody needs, service and help, they call us. So we're all around, Astoria and Sunnyside and Ditmars and everywhere. So yeah, it would be helpful to be able to connect with, the proper resources. And like you mentioned, if there's a gap, then we can work to fill it.
Okay. Thank you for
Great.
that.
So if there's no other business, should I make a motion to adjourn?
Yes.
Nice.
Okay. Second that. Okay. All right. Okay. Until next time.
All
Thanks
right.
all.
Okay. Take care,
Yes,
everybody.
good to meet you all.